breastfeeding after childbirth is decreasing day by day. So, what is the reason for this? The main reason is being the cesarean section, the procedure which is being promoted by most of the doctors, most of the gynecologists. So, because this procedure it takes about 10 to 15 minutes. So it saves the time of a doctor as well as it helps them to make money because billing will be in terms of lakhs when it's a cesarean section. After cesarean section, the woman will not be fully conscious and she will not be having the desire to breastfeed her child, which causes suppression of breast milk secretion. Second thing is psychological. The woman thinks that she is not producing the sufficient milk for her baby. Third thing is the women think that the shape of her breast gets affected if she feed her baby. So fourth is they start feeding her baby breast. They do breastfeeding. So after few days they stop the breastfeeding. So this is because most of the women nowadays will be working. So working women they say that sir I'm working so go to work at that time I can't breastfeed my child, so there will be a gap, there will be a huge gap of around 8 to 10 hours. So when this gap is there, so natural suppression of the breast milk occurs resulting in complete cessation of the breast milk. Next question is what will happen if we don't feed our baby with the breast milk? So because many think that they have so many alternates like a cow milk and also certain powders which are a substitute for these breast milk. So what will happen if we don't breastfeed our babies? First thing is the breast milk, human milk will be having, what is the composition of this human milk? It will be having 87% water. The major component of the breast milk is the water, which is about 87%. Second highest component, the major nutrient of breast milk is the carbohydrate. The carbohydrate, which is about 7%. Third thing is the fat, highest next to the carbohydrate, highest nutrient which is there in the breast milk is the fat, which is about 4%. Third thing is that the last macronutrient is the protein. It's just about 1%. So protein component in the breast milk is just 1%. So along with this, it will be having certain essential vitamins as well as minerals, and one more major component of this breast milk is the antibodies. So coming to the components, the first that is the water, 87% of water. So highest water will be there. So the baby doesn't need extra water. Baby need not be fed with water which is on breast milk. So next component is the carbohydrate. Highest carbohydrate, that is 7% carbohydrate. Carbohydrate in the form of lactose will be there. So why do the baby need some more carbohydrate, that to lactogen 7%? So because it helps in the development of a brain. So baby, newborn baby, so brain development will be so fast, and this brain requires, doesn't require the protein, but it needs the presence of the carbohydrate in the form of lactose. So next is the fat. So fat is 4%. Next to the carbohydrate, highest component is the fat. Fat, again this fat, human breast milk fat will be having the lauric acid. So this lauric acid again most essential so nutrient for the development of the baby as well as for the immunity of the baby. So along with this lauric acid, certain essential fatty acids will also be there, which helps in maintaining the health. So after the fat, next comes the protein. So see, the last one is the protein. Protein is just so 1%. Again, this protein, the protein which is there in breast milk is whey protein. And this whey protein is gets easily digested and gets easily absorbed. So after the protein, so next certain vitamins like vitamin A, D, E, and as well as vitamin K will be there. So along with that, certain minerals like calcium, magnesium, as well as phosphorus will be there. So one more most important component of our breast milk is the antibodies. This antibodies provides immunity to the baby. See, because a newborn baby up to certain age, the organs will not be developed completely, fully developed. So the immunity will be less, immunity will be low. So they are more prone for infections. To counteract this, to avoid this, the mother's milk, that is the breast milk, will be having the antibodies which will protect the baby from infections. Especially The first milk is a colostrum. The milk which is secreted, which gets produced immediately after birth of a baby, is called as a colostrum, and this colostrum consists of maximum amount of antibodies which can protect the baby for few months against any sort of infections. See, all these components, that is the carbohydrate, fat, protein, vitamins, minerals, they are in such a balanced manner. So we keep on insisting to take, generally the doctors keep advising to take more protein, but what the nature is telling is the protein requirement is very minimal, just 1%. Even though it's a macronutrients, its requirement is very minimal, just 1%. So when we consume this protein in larger quantities, it results in many diseases. Whatever the diseases which we are seeing nowadays, that is the diabetes, hypertension, as well as the cancer. So one of the most commonest cause of is high protein intake. Next, you may have the question like cow milk. We have certain substitutes like a cow milk can be can it be given as an alternative to mother's milk? One thing. Second thing is certain powders which are used as a substitute to breast milk. Can it be used? Milk other than the breast milk will be having a lesser amount of carbohydrate. That is the lactose content will be less. So, and this lactose is mainly necessary for the brain development of a child. When there is a deficiency of a carbohydrate in the form of lactose, the brain development will not happen normally. Next is the fat. Again, the fat other, that is a cow milk, will not be having the lauric acid. Even though it is there, its concentration will be very less. Next, the protein which is there in the cow's milk will be casein. It's not a whey protein, it's a casein. And this protein, it's hard to digest. So when it doesn't get digested properly, the metabolism gets affected, resulting in certain diseases. Next, very important component is the antibodies. So these antibodies will not be there in any other milk, as well as the powder, whatever we use as a substitute to mother's milk. So these antibodies, when the child won't get these antibodies, the immunity will not be there. So we need antibodies for our immunity. So immunity gets reduced, immunity will not be there at all. So the child will be more prone for infections, chronic, acute or chronic infections will be more in such a child. Not only the child, even the mother will suffer with certain health issues if she don't feed her baby with her breast milk. So during a breastfeeding, the menses stops. Regular cycles will not happen as long as the woman keeps on feeding her baby. So because of this, there will be least exposure to the hormones like estrogen. When the exposure to the hormone, that is the estrogen, gets reduced, she will be at a lesser risk of developing certain cancer, especially cancer, carcinoma, cancer of breast as well as cancer of ovary. How long the woman is supposed to breastfeed her baby? It is at least for 1 year. The cow's milk, which we keep giving to the newborn babies as well as to the children, thinking that they need more calcium. So this cow's milk will have a more toxic effects, more side effects. So details of these toxic effects of cow's milk, I will be telling in my next video. If you want to have a precise and scientific information about health, then only subscribe to our channel. Namaste.